Hello and welcome to a short training video. I apologize for the quality of the video. Unfortunately, we were on a low budget, but we wanted to get this out to people as soon as possible. So what's the purpose of us putting these kits together? Well, we took a look at after-action reports of major incidents such as shootings and bombings, and it showed that all these incidents had trained bystanders, but there was a limited amount of medical equipment to treat the injured. A lot of these bystanders used their shirts and belts, whatever they had to control severe bleeding, they used. So our thought is, in Manitowoc County, our first due units such as first out engines from fire departments, local law enforcement, and first responders will carry these kits. So as they arrive on scene, we can have these kits available to medical trained people that can help until EMS can get there. Now, a lot of times squad cars are the first ones there and they are securing the scenes for us. In a patient that has severe bleeding, it's important to stop that bleeding now. So don't forget you've got these kits, and there's probably medically trained people that can help them. In the kits, there's enough equipment in there to treat 3 to 6 patients that have bleeding problems. So what does the kit look like? It's a small green backpack, and inside that backpack is a trauma dressing, 2 bleeding trauma kits, and then extra gloves that you can put on. So the 2 bleeding kits that are in there are vacuum sealed to help preserve all of the equipment that's in there, and this is what they look like. The items that are included in the trauma kits, there's a set of 2 large gloves, 2 medium gloves, 2 4x4 sponge pads, 2 triangular bandages, 2 popsicle sticks, 1 2-inch Coban, 1 4-inch Coban, and if you're not familiar with Coban, it's a self-adherent material. It's much like vet wrap if you're familiar with that. 1 4-inch ace bandage, 1 Sharpie, 1 EMS shears, 3 antiseptic towelettes in case you get blood on yourself, 2 5x9 ABD pads, 2 4-inch rolls of cling, 2 Tegaderm dressings, 1 Vaseline gauze, a commercial SWAT T tourniquet, and 1 roll of 1-inch transport tape. So what can be used as tourniquets in the kits? The commercial one is the SWAT T, and we're going to see a video at the end of this presentation of how it's used. The nice thing about the SWAT T is if you're using it on an arm, there's usually enough material to make 2 tourniquets. Triangular bandages along with some popsicle sticks can be used to make a tourniquet. We'll watch a short video on that. And also the ace wrap, if you pull that tight enough, that can work as a tourniquet. And the Sharpie that's in there, well, that's to write down the time that you applied the tourniquet. Chest seals, people that have got injuries to their chest, we need to seal the holes. There's Vaseline gauze in the kits. There's 2 large Tegaderms. The wrappers from the package can be used. It just needs to be an impervious material, and then you may also need some tape. For hemorrhage control, we've got 2 5x9s ABD pads. Those are rather absorbent. We've got some gauze sponges. Coban, as I said, to wrap the pads with. 4-inch cling, that can be used to pack inside the wound if you need to, or also to hold the dressing in place. And then in the backpack is also 1 large trauma dressing to control significant bleeding. So what's a sucking chest wound? We talked about that a little bit. It's a wound to the chest. It could be a bullet, it could be a knife. It's actually any penetrating object that goes into the chest. Remember, if it's a bullet, a knife, a stick, whatever, it may have an exit wound also. So, what can we use to seal those penetrating chest injuries? We've got some Vaseline gauze, and the video that we're going to see here in a little bit is going to show you how to use the Vaseline gauze. The tegaderms are large clear bandages. They can be cut if you need to. There's 2 of them in the package. If it's a regular bullet wound, you may be able to cut them in half and have 4 of them available. Plastic wrap that the kit is in. The packaging from the Vaseline gauze can also be used as an occlusive dressing. Once again, don't forget to check for an exit wound. If breathing gets worse after you apply an occlusive dressing, you just need to lift up part of that dressing, let the victim exhale, and then reseal the dressing. So, here is the video on using Vaseline gauze.
To create an occlusive dressing with petroleum gauze, you will need the gauze and tape. Open the package with the provided flaps to expose the petroleum gauze. Place the gauze and wrapper directly on top of the wound site and remove the other half of the wrapper.
Keep the other half of the wrapper. It may be used as another occlusive dressing. Also in our kits are some large tegaderms. They can be used on people that aren't very hairy and aren't sweaty, and they can be cut to size. The Vaseline gauze that you see here is excellent application for somebody with a very hairy chest or with somebody that is very sweaty. Another important note is prior to placing the dressing over the hole, wait for the person to completely exhale and then lay the dressing down.
Use tape to secure 3 sides of the bandage to the casualty's chest. The 3-sided occlusive allows pressure to escape the chest cavity, preventing the onset of a tension pneumothorax.
I recommend only taping 3 sides. And don't forget to check for an exit wound.
If a 4-sided occlusive is to be applied, the last piece of tape should not be applied until the casualty exhales.
And then this next video is going to show you how to use a cravat. And we have popsicle sticks instead of using the Sharpie pen as your windlass.
So suppose you got a severely bleeding wound that just can't be controlled with direct pressure. You've tried pressure dressing or direct pressure hasn't worked. As we're talking about here, we're going to try to improvise a tourniquet of sorts. In this case, we're going to use what's called a cravat, or triangular bandage. The first step is to form this into about a 4-inch wide band. That's rough, somewhere in that area. Like so. Place it underneath the injured extremity. We're going to wrap it around the extremity twice. And then we're going to do a single overhand knot over the actual, over the bandage. Now we're going to make our windlass device. We're going to use a stick, or in this case a Sharpie pen.
You'll notice in our kit we do have a Sharpie pen, but we prefer that you'd use that to mark the time the tourniquet was placed. There are some reinforced popsicle sticks in each kit that can be used as the windlass.
Single overhand knot over that. Kind of like so. We're going to twist that until the bleeding stops, talking bright red blood, and we eliminate the distal pulse. And that's kind of the key, is getting rid of that distal pulse.
And then don't forget to mark a T on the forehead with the Sharpie and the time that the tourniquet was placed. And then the last video that I've got is how to use the commercial SWAT T tourniquet.
SWAT T, Stretch, Wrap, and Tuck Tourniquet. The SWAT T tourniquet from TIM Solutions is a unique multi-purpose medical device. The wide elastic band construction of the SWAT T has been clinically shown to function effectively at lower pressures than traditional windlass style tourniquets. This means less potential for injury to the patient and less pain from the tourniquet. The SWAT T's unique design allows it to serve as a tourniquet, pressure dressing, and elastic wrap among numerous other potential uses. The intuitive stretch, wrap, and tuck method is easily learned and retained by non-medical personnel and medical providers alike. The SWAT T is compact, lightweight, and economical at less than half the cost of other tourniquets on the market. In use and proven at home and abroad, the SWAT T was designed by a former Air Force PJ and currently practicing emergency room physician. The SWAT T is ideal for military, law enforcement, EMS, K9, pediatrics, and residential applications. For a list of authorized resellers and further information, go to www.swat-t.com.
Open the package. The twist-snap method of opening has been found to be the simplest and fastest method of removing the SWAT T from its packaging. Tightly grip the SWAT T overhand with thumbs to the center and turn your hands forcefully in opposite directions. The SWAT T packaging also has 6 tear points located on the sides of the package, allowing for traditional horizontal opening at the top, bottom, or center of the package. Pressure indicator markings. The SWAT T can serve as both a tourniquet, a device that stops blood flow to a limb, and a pressure dressing, a device designed to cover a wound and apply pressure. There are markings located along the exterior of the SWAT T that visually indicate the amount of pressure being applied and thus in which mode the device is functioning. The more the SWAT T is stretched when wrapping around the limb, the more pressure it will apply. This will be indicated by the oval markings becoming circles and the diamonds in the center of the ovals becoming squares. Concurrently, the strip of rectangles above the ovals will become a strip of squares. When the SWAT T is used as a pressure dressing, it should be wrapped tightly enough to apply pressure to the wound, but not so tightly that the ovals, diamonds, and rectangle strips distort to the tourniquet pressure indicator shapes. Tourniquet. When used as a tourniquet, the SWAT T should be applied between the wound and the body tightly enough to stop all blood flow to the limb. Be sure to overlap the first wrap of the tourniquet to secure it in place. Subsequent wraps should be tight enough to stop blood flow as shown on the pressure indicator markings. On the final wrap, remember to place your fingers underneath the SWAT T to provide a place to tuck the tail of the tourniquet in order to secure it in place. If you forget to do this, do not unwrap the tourniquet. Simply locate the edge of a previous wrap and pull it up to make room to securely tuck the tail underneath. It is accepted that it will be difficult to wrap the tourniquet without some twisting or bunching in a real-world application. Nevertheless, every effort should be made to apply the SWAT T as flat as possible, since less pressure is required to stop blood flow with a wider tourniquet. A wider tourniquet is also safer and more comfortable for the patient. Never remove a functioning tourniquet simply to straighten a twisted or bunched up section. In the unlikely event that bleeding continues, a second SWAT T can be applied above, below, or directly on top of the first SWAT T. Do not remove the first SWAT T in order to apply the second. Placement. Ideally, you want to expose the limb and visually identify the source of bleeding in order to place the SWAT T between the wound and the body. In some circumstances, visual identification of the wound location may not be practical. In those instances, the SWAT T should be placed as high on the limb as possible. Be aware that a patient may have multiple wounds and that careful monitoring should be continued after tourniquet application to ensure that all bleeding is controlled. Always double check the tourniquet application after you move a patient. Pressure dressing. Some wounds, such as those high on the arm or leg or in the groin, are not amenable to tourniquet placement. These wounds should be treated by packing with a hemostatic agent or gauze and then utilizing the SWAT-T as a pressure dressing. The purpose of the SWAT-T in this instance is to apply pressure to the packing material and to protect the wound from further contamination. Be aware of how tightly you wrap the SWAT-T in this application and check the pressure indicator markings. The tourniquet application band is a patient information device located in the center of the rolled SWAT-T, which can be applied to the patient's wrist. Once bleeding is controlled, you may fill out the tab with appropriate patient care information such as tourniquet application time, heart rate, blood pressure, blood type, and whether radial pulses are present. Please note that transport of a critical patient should not be delayed solely to complete the tab.
So tourniquet marking, the important thing is when the patient gets to the hospital, the staff needs to know that the person first of all has a tourniquet. So by placing a T on the forehead is the universal sign that someone has a tourniquet, and then followed by the time that it was actually applied. Some common devices or commercial devices that are out there. The CAT tourniquet, you can write right on the device, and as you saw in the video, the SWAT-T has got an armband. So in summary, place these kits in a unique location where it's seen every day and you remember where it is and you have easy access to it. During a crisis situation where you've got one or multiple people that have a bleeding problem, don't forget you have these kits, because it only takes a matter of seconds with a major bleed and a couple minutes with a not severe bleed that a person may bleed out. So just don't forget where you got them and that they're there. Hopefully we never have to use them, but if you do, you know where they're at. If you need more kits, you can contact me at the phone number there, or you can get a hold of Manitowoc Emergency Management. We'll have some extra kits. So I'd like to thank just some people that helped with this project. The HERC Region 3 actually funded the program through the Regional Trauma Coordination, the RTAC. The Two Rivers Kiwanis, they actually bought the green backpacks. Manitowoc County Emergency Management is going to be holding the backpacks for us. Mavis Division 128 actually applied for the grant. And then the people that put the kits together have been myself, Chris Dallas, and Travis Walk. So thanks for watching. If you've got any questions, contact an EMS provider or you can give me a call. Thank you.